Finally, the boss is here.
I'm sorry, guys. I'm
Hi,
going to make you
Moiz.
all go into mute so that I can speak.
Okay.
Maybe all done.
All right. Thank you so much for showing up on time. How many are we? 1, 2, 3, 4, 5. You can use the chat box to chat with me, just so that to prevent interruptions. I've kept everyone at mute, but soon I'll let people talk. So what time do we want to start this? Can I get a suggestion on the chat box, please? Okay, let me at least let my dear treasurer speak. Betty.
Yes.
What time do you want to start this?
The time ilikuwa saa 12, so if we can start earlier, it's good, I think.
Okay, cool.
Or maybe we can go mpaka maybe saa 12:15. If there are any announcements, it's okay. So tunaweza kwenda tukiwasubiria watu wengine saa 12:15 we start.
I think we can post in our groups at least to do the same.
Hamza amesha post.
Okay, fine. Okay.
Yeah.
All right. Yes, I think we can start. I mean, people will join later and then the whole point is to have a discussion. I'm sure whatever I'm going to speak about is already spoken by someone in the media or in the news. And what I'm going to say is just emphasizing the key points. So guys, I'm going to start. I hope everyone is ready. Do you guys know how to use the chat box? Just type anything on the chat box so that I can know exactly what you guys are. Can you all hear me? Okay, there are 2 participants who have raised their hand. So this raising of hand is actually for like questions. So let me ask Miraji. Where is Miraji? Hey, Miraji.
Hi, Moiz.
Hi, how are
Yes.
you? You can hear me, right?
I'm fine.
How are you? I mean, do you know
I was raising hand, meaning
you wanted to ask a question, or you
thought
wanted to say?
No, I wanted to say that I'm here.
Oh, okay, all right.
Yes.
So press the button again so that the hand can be lowered, and when you have a question or something, you can do the same thing. Okay, I'm going to mute you again now.
Okay.
Okay. All right, guys, I'm going to start. I hope everyone can hear me. There is on the right-hand side of the lower bottom place of your phone, if you're using your phone and computer, there is an area for reactions. I don't know if it's there in the phone, but it is there in the computer. Like I can do this, and then it shows up on my screen like a thumbs up that everything is okay. Or you can write in the chat box. What you can type something on the chat box, like I see Godfrey has typed 620 I hear and all that. So something like that, you can type and ask questions in between of the presentation. All right, I'm in a part of my community group for COVID-19. All protocols observed for Rotaract. We can't do the toast and all that because of the number. I wish we were many and we could have just started the meeting officially. But I think we can do that. Let's just do that. Let's spend 5 minutes and start off the meeting properly as the way Rotaracts do. So Betty, you will take the toss. Godfrey, you will take the four-way test. Miraji, you will take the loyal toss. I hope that's okay. So Betty, let's start, and I will take a grace. So I'll start with a grace, and I'm just going to pray the way I know. So, oh Lord, please help us in this difficult time. Let us come together as a community and fight this evil that is in front of us. I hope this meeting is fruitful, and I hope that we all learn something. Amen. Betty, can you go ahead with the, I think you can do the four-way test. Betty, go ahead with the four-way test. I've unmuted you.
Okay. The four-way tests of the things we think, say, or do. Is it the truth? Is it fair to all concerned? Will it build goodwill and better friendship? Will it be beneficial to all concerned? Thank you.
All right, thank you, Godfrey. Betty, I don't know why, but I can't unmute you for some reason. Have you? Can you unmute yourself, Betty? Okay, Betty, can you speak?
Yes, do you hear me?
Yeah. So four-way test is done, and grace is done by me. I think we can we can do the loyal toss. I'm sorry, Miraji, I forgot how many things we have. Let's just go ahead with the loyal toss, and then Miraji can do the final toss if possible.
Okay, thank you, Chairman, distinguished
Okay.
guests, and my fellow Rotaractors and Rotarians. I know we have Rotarians. I thank you all for being here and for being part of this. How do I say it? It's an what?
E-meeting.
Yes, e-meeting. So can we raise a toast to Rotaract the city?
Okay.
Rotaract young professionals. I don't know.
Okay,
What's
fine.
for Rotaract again? And all Rotaract and Rotary worldwide.
All right. So, okay, I'm going to mute you again. Thank you so much for that. So guys, I have a 10-minute kind of presentation for which I would like your attention. So this COVID-19 has made everyone scared. We should be, because it's something that we cannot handle, even with all this technology, all this lab advancement, and everything that we have done so far. We still haven't managed to control it. It is very unfortunate. I need to show this to you. It is unfortunate that we currently have 32 total cases so far. Two of them died today. One was a 51-year-old and another was 57. And all of them were COVID positive. So the numbers are rising, and I hope that Easter and these holidays that are coming, I don't know what will happen, but I just pray to God that everything will be okay. So let me start my presentation now. And can you all see my presentation? Just give me a thumbs up if you can. All right, thank you. So basically, this virus was found in China, as we all know, it is currently thought of being an airborne and respiratory droplets. The difference: airborne means that when you cough or sneeze via the air that we breathe in, the virus can spread. Initially, it was thought that the virus forms small particles, and these particles, they go and probably are stuck in the tables or chairs or the doorknobs, and then you touch it and you get the virus too. So initially it was thought that this is how it spreads, but now people are saying that it also spreads through air, just like any other flu. So soon you will hear the ministry saying that you have to wear a mask. So be ready for that. And I will give you some information about how to make a cloth mask. It's not as effective as a medical or surgical mask, but it is something is better than nothing. So this virus was found in December 2019 in China, in Wuhan, as we all know. And now it has spread all across the world. It is unfortunate that we could not control it until it became like this, because we knew it was happening in China. I don't know what we were doing by that time. So this is not the current statistics. The current statistics I've already shown you. 32 people have been diagnosed with COVID, and unfortunately 3 have died. And if you look at the age or the trend, almost every one of them are in the range of 50s or 40s. So be careful. Tell your babus and bibis that this is serious and they should take care of themselves. And avoid meeting them frequently, because you never know, you might be asymptomatic, meaning you don't have symptoms, but you have COVID or you have corona. And then you go to your bibi's house or your babu's house and then you give it to them. So be careful, right? So as I said, it can spread from one person to another person. It is, if you're talking, you're sneezing, and especially when you're symptomatic meaning you have the symptoms like fever, cough, running nose, sore throat, and you start coughing or sneezing or talking, other people around you can get this virus, okay? It is also thought that, like I said, that if you can, it can be on the surface, like the virus can be on the surface, and yet you can get it. It has been researched that the virus can stay for up to 24 hours. And certain researchers are saying that it can also last for 3 days or 2 days. I mean, that's amazing for the fact that this virus is that resistant to the natural environment. In normal sense, viruses are not that resistant to the environment. And this is now spreading, like, you know, the symptomatic patient, a patient who has flu and cough and fever are more likely to spread it to you. But don't forget that there are people who do not have any symptoms, but yet they can spread it to you. So it has become, you will soon see the ministry telling you to wear a mask, even when you go outside. So these are the common symptoms that you will find: fever, cough, and shortness of breath. I would like to emphasize that COVID is divided into mild, moderate, and severe. The mild and moderate cases are the ones which have fever, cough, sore throat, running nose. If at all you start getting shortness of breath, meaning difficulty in breathing, that means you are in a severe case category. And I will show you a symptom checker, which you can use at home to know whether you are in a severe stage or mild stage or moderate stage, and what you need to do if you have symptoms. So the symptoms, like I said, they're fever, cough, shortness of breath. And sometimes other people can come with headaches, sore throat, running nose, diarrhea, and vomiting is also now, people are saying that they don't have these flu-like symptoms. They come directly with diarrhea, and yet they can be a corona patient. So the government has the right to test. No hospital in Tanzania has the right to test for COVID patients. If a hospital suspects that probably you have COVID or corona, they will inform the government. The next day, the government will come, take your samples, send it to their labs. If you're positive, they might put you in isolation. This term isolation and quarantine, many people are not understanding it. Quarantine means that you are suspected to have corona. You're suspect, meaning that you came from an area whereby probably corona is prevalent, or you came in contact with someone who has corona. That is only when you are kept in quarantine, okay? Isolation means you're sick and you have to stay away from people and stay in your own room with your own utensils and so forth. So there is this test that the government is doing. It's called PCR. PCR is basically looking at the virus, okay, from a sample taken from your nose or mouth. Okay, and this is a very expensive test. They are available, but they do not have the kits. Other hospitals do not have the kits. I've got the information that Aga Khan will soon have the kits, but that's depending on the government. Nani. Betty, do you have anything to ask? I'm unmuting you. You have raised your hand.
Oh, yes. Oh, this was previous. But can I ask about that test? I saw a video. It's like something was injected in someone's nose. So how deep does it go? Is this the same test you're talking about, or?
So probably what you saw was it's a way of injecting a medication, okay?
Oh.
But testing this is like you are taking a kind of a cotton wool or a cotton bud, all right, and you're putting it in the nose, and you're taking the material which is found in the nose, and then you're keeping it in the machine. And in that machine, you will know whether this virus is there or not. That is how the test is done. So it could be similar to what you have seen, but the test is different. And there is also something known as, you can even give medication through the nose. So that, I hope it clears your doubt. So I'm continuing now.
Okay.
All right, guys. So this is WHO's 7 steps of preventing the spread of virus. Wash your hands frequently. Guys, we have been told to wash our hands every 20 minutes with soap and water. Soap and water is enough. Hand sanitizers, make sure the alcohol level of the hand sanitizers is greater than 60%, or else do not buy it. Because there are many hand sanitizers right now that have been sold and they have only 40% or 30% of alcohol, which will not work. So it's useless. Avoid touching your eyes, nose, and mouth. You can remember this by the mnemonic, avoid touching men, M-E-N, M for mouth, E for eyes, and N for nose. These are the sensitive areas. These are the areas whereby you can get infection very easily. Cover your cough or sneeze. And this I will show you how to do it. But we have been trained in even our meetings. If any one of you was there, Diamond's wife, Rotarian called Diamond, her wife taught us about the office etiquettes. And one of it was about the cough, that you use the bent elbow. Yeah, you use the inner part of your bent elbow to sneeze or cough. And this will actually help you not touch that area, because it's less frequently that you even touch that area. And now in hand washing, remember to also wash your elbows if you're doing that. Avoid overcrowding space. It's very important not to have close contact with people. 1 meter distance is okay. Initially, they did say that it was spread by respiratory droplets, like small particles, which then go into the surface and you can get it like that. But now they are saying it's also airborne. So make a distance with someone who has flu. There is no harm in avoiding people right now, seriously. even your girlfriend or your boyfriend, and you can tell them, hey guy, hey, if you have flu, stay away from me. If you have a fever, cough, and difficulty in breathing, I'm actually offering myself. I mean, if you need advice, if you think you have fever, cough, Nani, in these difficult times, you can call me. All right, and I can advise you properly. So, and make sure you call me. Don't come to my place. Get information from trusted sources. Guys, WhatsApp is ruining everything for us. I mean, I see people WhatsApping so many things which are irrelevant. Use trusted sources. The WHO, which is World Health Organization, and CDC, which is Center for Disease Control, is a very absolute good place for you to get good information. And I will share the link with you. So as you can see, these are the ways of stopping the spread. Wash your hands properly, maintain physical distance, avoid touching the eyes, nose, and mouth. And if you have a fever, cough, difficulty in breathing, seek medical help early so that you can be given an advice, okay? Now, these are the same things, okay, which I talked about, the 7 steps of WHO. I'll share some of the material, so don't worry about it. I just want to really emphasize on the hand washing. Guys, hand washing, many people I've seen, they don't know how to wash their hands. And it's a shame. So I'm showing you something. I hope that you can see. Look at the steps, right? First, wash your hands with water. After which, take soap. Don't take soap first. You're contaminating that place of soap. So take water, wash, then soap. Then the first movement is rubbing the palms, okay? Both the palms. Then interlocking rubbing of your fingers, all right? Once you're done with that, you have to rub the inner digits of your hands, your thumb, your palm area near the thumb, and then you wash your hands again. This is how you should do it. 40 seconds. We were taught in primary school to sing happy birthday. Don't sing happy birthday loudly. Sing it quietly, or even without someone hearing you in your mind. So make sure hand washing is appropriate. So now this is a symptom checker. If you cannot see this, I'm sorry, but I will show you. I will send this file to you. So this is a symptom checker, and this is what can tell you whether you are in the mild case, moderate case, or severe case. So it's a point system, and it just says that if you have 6 to 12 points, you need to call the doctor. If you have 12 to 24, you are very infectious. You should be informing the government as your duty that I am very infectious, I need to be isolated. I cannot even stay at my own house now, okay? So what if, let's say, when should you contact your healthcare provider? I've already told you. You can check the symptoms. And if you are in the mild to moderate cases, like fever, cough, sore throat, that means you are mild to moderate. But as soon as you start having difficulty in breathing, chest pain, and all that kind of symptoms, that is severe. Mild to moderate cases can be isolated at home. I will teach you how to do that. But severe cases, guys, you don't mess with it, because this virus can attack very quickly. Sooner or later, you will see the person deteriorating if you are a caregiver. So take that person to the hospital and inform the hospital prior, before even taking the person. Or you can call me, I can arrange things for you, and we can help each other. Now, let's say you are at home now, you are the ill person. I hope that no one gets ill, but let's say if you are ill, what then? So if you have fever, cough, right? First of all, washing of hands. Guys, again, every hour, every 2 hours, wash your hands with soap or water. And if you have sanitizers, use them, please. Make sure you are in a separate room. If you're in a separate room, you should be having your own utensils. You should be having your own clothes being washed. You should be not attending work, and you should not be attending public spaces. And when you're coughing or sneezing, please use your inner part of the elbow. Do not use your hands. And if possible, wear a mask so as to protect others. And the person who is helping you, that person should also wear a mask. For all the members of the household, just follow all the precautions which I've already mentioned. Hand washing. If you go to the sick patient, wear a mask and tell the person to wear a mask as well. Okay, and you should be monitoring yourself for symptoms like fever, cough, sore throat. Okay. For the caregiver now, the person who is immediately taking care of the person who has mild symptoms, you need to be careful. You should be washing your hands frequently. You should be wearing a mask. You should be washing their dishes or whatever separately if you are doing so. You should be cleaning the doorknobs of that person's room, and you should be monitoring for symptoms because you are more likely to get it than other people of your family. 1 meter distance can be maintained even in a family of 10. It is just about you communicating it, okay? Lifts. You know, many of you use lift. Lift here, you can have a 1 meter distance, and if you want to, don't get inside the overcrowded lift. You're just costing your life here. So like I said, generally you need to be very, you don't need to panic. Mild symptoms usually go away. That's why 14 days, be at home. Don't rush to the hospital. You are endangering a doctor, a nurse, or even if you want to go to the hospital, please inform us. Please call us, okay? Find out the number of whatever hospital you want to go. Call them before, or tell someone to go to the hospital first. Inform them that there's a patient who's suspected case who thinks he has corona, so that we are alert. We are wearing our protective gear, right? Self-isolate yourself, meaning stay in your own room. Do not even stay like in the sitting room all the time. Like you can be in the room, but wear a surgical mask or a medical mask. Wash your own utensils, wash your own clothes, frequent hand washing, and monitor yourself. If you think you are getting worse, your caregiver should be informing people or the necessary government officials. So the number, emergency health line right now is 199. If you want any information, you can call 199, and they are responding very well. They have actually taken it very seriously. So I would just like you to few pointers in terms of what we have been telling our community. You need to talk to people. I mean, you can talk over the phone. You to your mom, your dad, whoever it is, like talk to people in these stressful times. It helps. It is therapeutic. Make sure that you have correct information. Don't take any WhatsApp message, forward it. You are just doing more harm than good. So WHO and CDC are the recommended websites. Eating healthy. There is, honey is very good. If you can take honey every day in the morning, it would be very nice, okay? And limit the time you use to watch TV, news, media. I mean, it's messing things up. Spend this time with your family if you can. If you're alone, spend time reading books, drawings, increasing your skills, public speaking, whatever you can do. This is where you can learn more, and please try to use it. CDC and WHO, World Health Organization. I mean, we have a task force in our community, which is spreading knowledge. You can have your own task force. It is very simple to do that in your own community. I hope you guys have it. And try to spread the word properly. Try to educate people. There are people who are not educated and they are illiterate and they still follow things like, you know, this, I don't want to mention his name, but this regional commissioner of ours is saying things which doesn't make sense right now. Anyways, I am done with my presentation. I hope that you don't do this to people. I hope that you wear a mask or get one as soon as possible, because it is going to, once the ministry says wear mask, you guys need to have one. Medical or surgical is better. If not, then a cloth mask is as good as anything. So as per what I said, 32 cases now and 3 deaths. It is getting serious. This is how, it's a guide to how to wear a mask. So basically when you wear a mask, while wearing it, it's okay to touch the front part, but while removing, don't touch the front part because that's already infected. Try to remove it from behind like this, okay? And make sure there's a proper seal, okay? So that it's more protective as compared to money. And guys, says that this coronavirus is about to get us. And I hope that this was helpful. It was a short one. And if you have any questions, before I end, if people want to treat themselves at home, fever, take paracetamol, 1 gram, that is 2 tablets, every 6 hours, all right? Hydrate yourself every day, like at least 2 liters of water. Number 3, steam inhalation. They say mvuki, I think. So boiled water in sufuria, put a bit of maybe Vicks or anything like, which is maybe salt as well. And then take a towel, cover yourself and start doing steam inhalation if you have the flu, okay? Salt water gargle, even it's nice because initially the virus is here in the throat and then it takes itself to the lungs. So before that, you can help yourself. All right, guys, thank you so much. That was my time. And I hope that this was interesting and entertaining and useful. And I hope that you spread the word to your community members. I now allow questions, and I hope that everyone has some questions. I don't see any questions in the chat group, but let me start with President-elect Darcy. If you have any questions, I'm unmuting you right now and you can ask me. Okay, I see Revocatus. Okay, let me find you, brother. Revocatus. Okay, Revocatus, the floor is yours. You can speak now.
Okay, thank you. Good evening, everyone. My question is like, according to our fight against Corona,
yes,
are we doing, according to your review as a doctor, are you doing enough on this, or we still lag behind according to our fight against coronavirus compared to other countries?
I actually, my personal opinion, if I want to share it right now, we are still not doing enough. Because first of all, we don't have even enough kits. Like we have 1,000 kits only to test for corona currently. And that was donated by WHO. CDC is allowing Aga Khan to test for the patients, but the government has not given any approval. Currently, Loganzila has been considered as an isolation area. And any patient who's a suspected case is sent to that hospital. And behind the hospital, there is a special ground that they have formed for these isolation patients. I must say that we are not prepared for this. We do not have enough ICU beds. We do not have enough ventilators. And we need to protect ourselves. So soon you will hear the ministry saying, wear a mask. So just follow that. It's not bullshit. Make sure that you wash your hands and follow the hand hygiene protocols. That is the only way we can be saving ourselves currently. I hope that answers your question. Okay. Curtis, I hope that answers your question.
Yeah, yes, thank you.
All right. Anyone else? Okay, Betty has a question. Let me unmute Betty. Okay, Betty, go ahead.
I have a question. Can I get more details about viruses? Because I know there's a big difference between bacteria and viruses. And I've seen like, I've Googled about virus and I've seen like the structure that we used to see in schools. It's kind of different with the presentations, people who are giving presentations of viruses. So I want to know, is virus man-made? When they say it consists of proteins and stuff like that. So is it man-made? And how do you really make a virus if it's man-made? And if it's not man-made, how does it exist in different forms? Like how does it make itself in different forms?
Okay, so first of all, viruses are just like bacteria. They are microorganisms. Microorganism meaning that we can only see them in a microscope. All right. There are some vaccines, basically. If I can talk about vaccines, vaccines can be made of viruses, which are not that harmful as the real viruses. So you can say that viruses can be made. Okay. But talking about this coronavirus, you see, every virus has a different shape. The one which we were shown in our primary schools and secondary schools, those were just a basic structure of the virus. There's so many different shapes, like there's a spiral shape, there's a circular shape, and it depends on the microscope, how you see it in an electron microscope, not even a light microscope. Electron microscope are small particles which are sent to the whatever you want to see, and they bounce back, and then you see an image. So actually viruses, if you talk about vaccines can have are viruses actually, but they are made in such a way that they don't infect, they infect you to provide you with antibodies, which are basically soldiers that fight against the real virus, which can affect you in later time. So I can say vaccines are viruses, but they are in a very small form that can help you. And about the man-made thing, yeah, so I think I answered that point of yours. And different viruses have different shape.
Okay.
Yeah. So here, Helma Linda is asking about, does lemons, orange, and ginger help? Okay. There are some natural remedies. I'm not a homeopathic doctor, so I don't know about natural remedies as much as, but I do know that you can take honey, and I will find out the word that I said. It was written kalonji, but I will find out what actually that word is. But there are special seeds, they're black seeds, and these seeds have been shown to somehow increase your immunity, and many people are using it currently. So honey and those seeds, I will post it in our group, and I hope that this can be spread to other people as well. So that is the wrong home remedy that I know. Oranges has vitamin C, so I think orange do help, and ginger and all that are home remedies for cough. So I would say don't ignore them, use them if you can, because right now nothing is right, nothing is wrong. Many people are saying this is right, this is wrong, this is right, this. Use whatever you can, I would suggest. Okay, Paul Nasira is raising their hand. Paul, okay. Paul, the floor is yours. 1 second. Yeah, the floor is yours, Paul.
Thank you, Adamji, for that presentation.
Thank you.
Mine is more of in line with how the fight has been against Corona. I'm calling from Uganda, and I'm saying different countries are putting in place different measures to counter this. Is there like any guided procedure that should be taken up by various countries, because we realize as much as people are saying there are lockdowns, there's quarantine, there's isolation, there are different degrees to which this is affected. Doesn't this have an effect at the end of it all, that if some countries aren't taking as strict measures as others, then let's get back to affect those that try to put up a bigger fight?
Okay, let me just answer you this by showing you something on the, I don't know if it's visible, but okay, I think I can't find it right now. I'm just going to explain it to you. So this pandemic issue that is currently going on, there are certain stages that every country is going through. Number one is imported cases. Imported cases means that a person who had corona came into your country, and this is the reason why the country has corona. Then the second stage is that when now it's in the local community, the community members are now passing it on to each other, all right? And the third is amplification of the cases. So local community, we could not control it, now everyone has it. So, and then the fourth and the last stage is whereby we now have resolution. So if you can see, Italy is going through resolution right now. So different countries have different measures. And it depends all on which stage you are in. So let's say if we were in a stage like China, currently we should have been on total lockdown. Lockdown meaning for at least 14 days. Not going out from home and staying at home and protecting yourself. That would be the measure. That's what the WHO is recommending. Social distancing, staying at home, hand hygiene, cough etiquettes. These are some natural things that people are now the country is going through, have been given guidelines. So there is partial lockdown, whereby maybe you are given a curfew that, okay, from 8 to 11, you are supposed to go out. After 11, everyone goes home. Certain countries are just having monitoring system, like in Tanzania right now. We have those people who are just going around in crowded places. They are told that if you don't have business here, please go away. And the police and all them are currently in a place called Kariako, which is very populated with people. So those are the different measures. And those are all by WHO. Just that the country, depending on their cases, are taking it differently. But in my personal opinion, we should be more aggressive. I feel like we should be more aggressive. People are saying Africans are lazy, they just want a lockdown, but that's not the case. We are not lazy, we are just scared. And instead of telling us that, hey, don't worry, we are taking necessary measures, our leaders are actually scaring us more. So that is my 2 cents on how different countries are taking different measures. Okay.
Thank you, Moiz. Can I come in, please?
Okay.
Yeah, so a quick one. I just wanted to know, you mentioned about the testing kits being only 1,000. Now we're talking about the population of around 57, 58 million Tanzanians.
Yeah.
With the ratio of only 1,000 kits. So how about what we're using before, maybe in terms of testing, maybe like hepatitis, cases like that. But also how maybe because I know how are people like you prepared or capacitated on do's and don'ts on how to treat and care for the sick, but also on the fighting the virus, because if my assumption is if there is no enough capacity given to frontline workers, we may likely losing most of you, but also we may likely see where I saw, for instance, a case, I think it happened in Uganda, where a patient was taken to Mulago and the doctors ran away. Yeah, so how better are we prepared maybe for this case?
Yeah, first of all, I mean, there's a shortage of masks. That's the biggest problem currently, because everyone else is buying a mask. So the healthcare workers, for some reason, we don't have enough masks. There are certain hospitals which have actually told me that our management is saying the mask will not be available until this time. So if you can get it yourself, just get it, you know. And I mean, that is just ridiculous, right? Other hospitals are well equipped. Like if I give you an example of my hospital where I work, Aga Khan, it is well equipped. We have all the PPEs. We have been given, every day we have been given a new mask if we come on shift. We have the necessary PPEs. We have posters. We have a screening area whereby if someone enters the hospital, they are first checked for these signs and symptoms and ask questions. After which, if we think that this person has any respiratory symptoms, he's taken into a different place whereby another set of people are asking. And we have a special ward whereby people are isolated. So isolated meaning kept there for testing and all that. So we make sure that we rule out other things because many people are forgetting. There is dengue, there is malaria, there is TB, there is HIV, AIDS, everything can kill you. But people are concentrated so much on corona that we are forgetting all these things. So probably we are doing that. That is how we are. And then we call the government. When we call the government, they come. And then they, based on their case definitions, meaning that they have criteria for saying that this is really COVID and we need to test him and all that, they test the patient by taking their samples, going to the lab and doing the testing. So African countries, to be honest, we are not prepared. We do not have the resources. If this hits us, if all hell breaks loose, I don't know what to say. But I just hope God is great and God knows that when something cannot be handled by people, He doesn't give us that challenge. I hope that we are all safe. We just need to practice our own hand hygiene and preventive measures. I hope that answers your question, Paul.
Thanks a lot.
All right. So we have, I don't know if the president-elect wants to say something. Darcy, let me unmute you.
I already asked my question about the testing kits.
Okay.
Maybe just to add more on that, you know, how do you see, because talking about testing, is there a room for someone before realizing the symptoms to go for testing before, you know?
That would
I
be only
believe that people would want to do something like that.
Yeah, that is only possible if your country has the available kits. And if it has abundance of kits, then okay, go ahead and make yourself, you know, like tell people to rule it out. But if your country does not have enough kits, I mean, that will be a very difficult thing to do. Although India and other places, they are going to houses, like literally if one suspect is found, the whole house is tested. But in our countries, this is not being done, and it's quite a challenge. Yeah. All right, any other questions? Please raise your hand so that we can have chat boxes available as well. Let me see the chat box. All right. So anyways, President-elect to me, thanks a lot, Doctor. All right. So, anyone else before we conclude this short summarized meeting? I'm happy to see 15 participants, great, from Uganda as well. This became an international meeting all of a sudden. That's great. Jacob, do you have anything? Just put it on the chat box so that I can know. Godfrey. All right, it seems people are okay with the presentation and all that. I'll share the slides. I just hope that you can use this for your personal use, because this is my community made, this was for my community. So I hope that it doesn't spread around like wildfire. And I just hope that you can use it for your personal things. If you recover from virus, do you get immune? Yes, you do get immune if you recover from a virus. It depends on whether you have the strain, like the same. So basically, viruses are complicated. They have different strains, like different types. Yeah. So they can be type A, B, C, D, E. Now, which type did you get? If you got type A, then you are immune to type A. If you're type B, then you're immune to type B only. That doesn't mean you're immune to all types of the same virus. So, but corona fortunately does not have different strains, and therefore, if you do get it, you do produce those soldiers, which I call antibodies in medical language. You can be immune to it. Thank you for that question. Okay, Vedan, right? Let me unmute you. Vedan. Okay, 1 second.
No,
all right, Vedan, you can talk.
Hi, my name is Bidan from the Rotary Club of Nairobi Parklands.
Oh, wow. Nairobi, Pole, for what is happening there.
No worries, man. My question was towards the effectiveness of the masks. I've seen some tweets online saying there are different types of masks.
Okay.
And then there are masks which are really effective, and there are some which are being sold on the streets which are not that effective when it comes to the prevention of viruses.
Can you see my screen?
Yes, I can. Yes, I can.
Okay. So you see on this part, you can see the arrow that I'm pointing?
Yes.
Okay. So there are different types of masks. There is one known as N95. These masks are solely for those people who are doctors, medical professionals, who are dealing with a corona patient, okay? And we are doing procedures on them. So procedures meaning procedures which can produce, you know, things out of their mouth, like we call it aerosols. So this is one for us. This is N95. Then what I'm recommending for the general public is a surgical mask, which I'm pointing right now. And as you can see, it is also, it actually prevents the spread. There is another one known as FFP1 mask. And currently, it is similar to N95. Again, that is for medical personnel use. Now, as you can see, the cloth mask, the sponge mask, the activate carbon mask, all these are not as useful, but something is better than anything right now. Because these are just 2-3 studies. I mean, there are not many studies done on this mask, but I'm sure after this pandemic, there will be a lot of them. So make sure, screenshot this and make sure you write, don't buy those dust masks. They are not protective. Many people are now selling dust masks. I mean, it's ridiculous. Thank you for that question. Any other questions? Okay, I think
you can share the presentation.
Yeah, I will try to share the presentation. I will change it a bit so that it doesn't look similar to my community presentation. But I'll share it. All right, thanks. Okay. Anyone else with a question? Guys, we will close the meeting down in around 10 minutes. So if you have any questions, please. Okay, Godfrey has a question. He says, time to exchange the mask. All right. So like I said, let me show you something. What I recommend, and please just go get that. Don't get any other mask. So this here is a face mask, okay? This is a surgical mask or medical mask that I was talking about, all right? When I try to put it on, okay, I have to put it on like this, right? This mask, if you have flu or cough or something and it's totally wet, it's time to change it. This mask can only be used for 8 hours. But in a resource limited setting like ours, Tanzania, Kenya, Uganda, we should change this mask after every 12 hours. Godfrey, I hope that answers your question. So after every 12 hours, please make sure you change the mask. Or when the mask is wet. So it can be someone coughing on you and you get the cough on your mask, please try to change the mask immediately. Anyone else, guys? Or Godfrey, you had another, maybe your question was different. Let me unmute you so that you can speak. Godfrey, was it the same question?
Yes.
All right, cool. I am happy that I've answered that question. Okay, Betty, do you have another question or your hand is still raised? All right, Betty does not have a question. All right, guys, anything else before we adjourn this meeting? It's a short presentation on COVID. The PPTs will be shared to you. Don't worry about that. Please use it as a guide. Please use WHO and CDC. Let me take this time to show you how to get there. So this here is a reliable source, guys. Just use it, you know, cdc.gov. Use it. It will tell you everything that is to know about COVID. There is also something about cloth mask. They are actually recommending to use cloth mask. They're saying that something is better than nothing. So you can actually learn how to make a cloth mask by the guidance given by this organization called CDC. Another organization is WHO. And this is a World Health Organization. Please try to use it. Please don't look at your WhatsApp and see, oh, this is right. Oh, I should try that. And seriously, it's not going to help you. It's just going to harm you. As you can see, everything about COVID is on the board. What they are doing, how many countries are affected, etc., etc. Okay, guys, thank you so much. I will let Ermelinda do the final toss, and we can. Okay, one new message. Let's see. Okay, fine. I will share my number then. You can WhatsApp me if you guys want. Sorry, I shared it privately. You can WhatsApp me if you want. I will help you out if need be. But I hope every one of you knows your country's emergency hotline. And they are also ready to answer your questions. It's not just for reporting a case. Okay, guys, Hermelinda, can you take over and do the final toss and thank everyone? I see there are Rotaracts from Uganda, Rotaracts from Nairobi, Kenya, and some Rotaracts from Tanzania as well. Over to you, Hermelinda.
Okay, okay. I give the final toss to the Arara Jacob. Listen to our presentation, to the Rotary Club of the City, to the Rotary Club of Arius. I see someone from Baharius, Nairobi Parklands. What else? for the Rotary Club of Kairuki, to all the guests, to Rotaract and to Rotary today. Remember to my number there, so we can share you the slide later. You can have a good evening. Wait.